So it's my pleasure to have with us this afternoon Dr. Neil Davis with us in this series that I'm calling Reflections from Pharmacy Leaders Advancing the Profession. Dr. Davis, I've known for a long time. I consider him a friend and a colleague and also a mentor. He was the editor, he's currently the editor and publisher of Med Abbreviation, but he was also previously editor-in-chief of Lippincott's Hospital Pharmacy Journal. And prior to that, or concurrently with that, he was director of pharmacy at Temple University and on faculty at Temple University. He has published numerous editorials demonstrating his vision into the future of pharmacy. He was also the co-founder of the Institute for Safe Medication Practices. He is a recipient of the ASHP Harvey Whitney Lecture Award. So it's my pleasure to welcome Dr. Davis.
Well, thank you. Thank you for inviting me.
So we'll start off with, we like to learn more about your journey into your recognition as a leader and in your career. And reflecting on your journey, you may wish to reflect on key events or people who influenced you in that journey.
I would be glad to do that, yes. I graduated the School of Pharmacy in Philadelphia College of Pharmacy in '53. And at the time, the Korean War was going on and they were drafting pharmacists. And I wanted to go in and be sure that I'd be involved in pharmacy. So I decided to enter a career in hospital pharmacy. And I got my master's degree with Herb Flack, and then got a commission in the United States Air Force, where I was stationed in Selma, Alabama, and then transferred to Athens, Greece. And then took a job as assistant director with my preceptor, Herb Flack, at Thomas Jefferson University Hospital. And from there, I became director of pharmacy at Jefferson Hospital, and then switched jobs and became director of pharmacy at Temple University School of Pharmacy. And I was there for about 15 or 20 years, and then took a position as full-time member at the Temple University School of Pharmacy. And concurrently, I was editor-in-chief for 30 years of Lippincott's Hospital Pharmacy. It's a journal that was published monthly. And now I'm retired, and my activities to keep me mentally busy is to author the book on medical abbreviations and a website. And I started out with 1,700 medical related abbreviations. And now I have 55 or 57,000. So that's what keeps me busy in my retirement.
So you're not really retired, you're refocused and keep, like you said, keeping active. That's wonderful. Thank you very much for that. So as you reflect on your career, what do you believe is your legacy or will be your legacy? And reflecting on this, you may want to look at of all the contributions you made to help advance the profession, what are you most proud of?
Well, I believe I'm most proud of my work in medication error prevention and establishing a clinical pharmacy practice. At Temple University, I was wise enough to hire excellent people to work with me, such as Mike Cohen and Sal Turco and Harry Berkowitz, and too many to mention. And while we were there, we followed the pioneers and established a satellite unit dose distribution system where the pharmacists were active in medication distribution and clinical pharmacy services. And we operated these 6 satellites, and we invited people to, on the weekends, to see how it was done. And we published some articles on this unit dose clinical pharmacy adventure. And at the same time, I was editor of the journal Hospital Pharmacy. And for 30 years, we published many how-to-do articles on unit dose dispensing, clinical pharmacy, and medication errors. And I believe gathering authors who had experience in this field and bringing would-be clinical pharmacists to Temple University to see how it could be done, and to, at the same time, realize there was need to publicize medication errors. And with Mike Cohen to co-found the Institute for Safe Medication Practices. And Mike Cohen took it over when I retired and has really expanded it to a worldwide influential activity to encourage safety. So I'm proud of all those activities, and I'm most proud of being able to work with all the people that enabled me to participate in this.
Wonderful. Well, thank you very much for that.
And I would like to add that my preceptor was Herb Flack, and he introduced me to the American Society of, at the time, called Hospital Pharmacists. And through their activity and through their journal and through their annual meetings, I was able to meet and be inspired by the leaders at the time, and took what they were doing and tried to advance it to a further level.
Excellent, excellent. So what words of advice do you have for students in their professional journey as they develop as leaders to help advance the profession?
Well, I think first of all is to be active in ASHP and to go to the meetings and meet the people who are giving the talks and go to the poster presentations, to get to know people and get to know what's going on in the industry. And the second advice is, if you ever get into a position of management in a hospital pharmacy, is that your success is based on how few mistakes you make in hiring people. To put it negatively, but to put it positively is to hire good people to take your institution further. Absolutely.
Absolutely. Wonderful words of advice. Thank you for that. So as this is embedded in one of the uses for these interviews is to embed them in a history course as we study the evolution of our profession. As we study the decades of the 2020s, one of the key events in that decade will be the COVID-19 pandemic. As other key events in our history, events that occur external to us shapes our profession, shapes, healthcare. How do you see this shaping our profession and being an opportunity for the pharmacy profession?
Well, let me first of all give a disclaimer that I retired from hospital pharmacy in 1993. So I'm not the right one to ask. You should ask someone who is actively involved in the practice of hospital pharmacy. So I really can't answer that with authority.
Okay, very good. Okay. Well, thank you. Any other words you want to share with us as we learn more about your contributions to the profession?
Just to state that there are pioneers in the profession, see what they're doing and see how you can move it forward. And just hire the right people to get the job done. And also, if you're going to stay in the field, keep current with what's going on in the literature. Absolutely.
Well, thank you very much. It's always a pleasure, Dr. Davis. It's been a long time. And thank you for taking this time to share with us your words.
Okay, it was a pleasure. Thank you.
So, yes, we would also like to hear about how the Institute for Safe Medication Practices was formed, because that's a significant event or body that was formed in the 90s.
Well, I had the opportunity to be the director of pharmacy service at Temple University Hospital in Philadelphia, and also the editor of the journal Hospital Pharmacy, which is published monthly.
Mhm.
And as I was reading the professional literature, I noticed that there were occasional reports of errors that were caused with medications that were published in the medical and pharmaceutical journals. And I thought to myself, what a shame this is that we can't publicize these errors so they don't repeat again. So I asked my assistant director at Temple, Mike Cohen, if he would like to take over a feature in the Journal Hospital called Medication Errors Reporting. And he said, of course I would. So what we did was we got an 800 number for self-reporting medication errors. It was a 1-800-23 error.
Mhm.
And we asked hospital pharmacists to report errors that occurred in their hospital, and we would publish them anonymously so that the hospital involved could not be identified. So we did this for a couple of years and accumulated hundreds of errors. And then we decided to write a book on medication errors, which was published in 1983. And we decided to form the Institute for Safe Medication Practices to further advance the spreading of knowledge of how medication errors could be prevented. And we went on for that way for a short period of time. And then I retired to Florida, and Mike Cohen took over the running of the Institute and raised it from two of us to a staff of about 20 or 30 now, and he's taken it internationally. So it started out on the fact that I had a voice, that I could tell each pharmacist in the United States, there are 40,000 who subscribe to our journal, what was happening with medication errors in their hospitals.
Wow.
And we noticed trends, and when we saw the trends, we went back to the manufacturers and told them to change the labeling or to do things to improve it and to educate pharmacists to where the dangers were. So this is how it started, and it's Mike has taken the ball and really run with it.
Wonderful. I really appreciate that. That's great. I'm glad you added that. That's wonderful. Well, again, thank you.
Okay.